Managing the hemodynamic status of patients perioperatively can have a direct impact on a patient's postoperative recovery. However, it has traditionally been difficult to measure cardiac output and other key parameters without invasive techniques such as thermal dilution using a pulmonary artery catheter. Although considered the gold standard for monitoring cardiac output, thermal dilution catheters often have associated risks, which limit their use to critically ill or high-risk patients. Patient monitoring during surgery under general anesthesia also presents significant challenges to obtain accurate and reliable information. The ideal cardiac monitoring device in the operating room is one that is minimally invasive and therefore safe, accurate, reliable, continuous and real-time, inexpensive, and easy to place and use. This video describes a less invasive approach called endotracheal cardiac output monitoring, or ECOM, that has the potential of fulfilling these requirements. By using the principle of internal impedance cardiography, cardiac output can be measured safely and reliably using a standard endotracheal tube. The ECOM system records voltages produced by a low-frequency current delivered to the tracheal mucosa by electrodes on the endotracheal tube. The proximity of the ascending aorta and trachea allows for the design of a device that can optimize the current and signal recording from impedance changes in the ascending aorta. The ECOM system consists of a monitor, cable, and endotracheal tube with 6 electrodes on the cuff and a source electrode on the shaft. The endotracheal tube is inserted using standard technique. Once the cuff is inflated, the tube cable is connected to the monitor and real-time continuous cardiac output, as well as other hemodynamic parameters, are displayed. The following animation demonstrates the use of the ECOM system and the principles of impedance cardiography. First, the endotracheal tube is inserted using standard technique. This places the cuff in close proximity to the ascending aorta. A low-voltage, low-frequency current of 0.2 milliamps at 100 kHz is generated between electrode number 7 on the shaft and electrode number 3 on the balloon. 3 orthogonal pairs of sensing electrodes on the cuff are used to measure the change in impedance caused by aortic blood flow. The orthogonal electrode pairs compensate for positional and anatomical differences between the cuff and the aorta. A total of 12 combinations of electrodes can be used for the impedance measurement of flow. If a signal is weak or lost on one channel, the ECOM software will search and select another electrode combination. The result is that the ECOM endotracheal tube does not have to be adjusted once it's positioned in order to obtain a usable signal. ECOM differs from other external impedance technologies by placing the sensor array internal to the patient in close proximity to the ascending aorta. The resulting internal impedance cardiography creates a small, focused electrical field to detect a large signal, as opposed to external impedance systems that use a large electrical field to detect a small signal. Internal impedance cardiography uses the principle of blood conductivity to measure cardiac output. Since blood is a conductor of electricity, as the blood flow increases, the impedance across the aorta decreases, and conversely, as blood flow decreases, impedance across the aorta increases. Proprietary ensemble algorithms are used to calculate the stroke volume based upon changes of impedance due to changes in blood flow. Cardiac output, as well as other hemodynamic parameters, are displayed on the monitor. Utilizing the impedance signals, a low-resolution ECG reading, and arterial blood pressure input, the ECOM monitor displays stroke volume, heart rate, cardiac index, and systemic vascular resistance. In addition, ECOM calculates and displays the patient's stroke volume variation. SVV has been shown to be an extremely valuable parameter for assessing the patient's perioperative fluid status. Animal and human clinical studies have been performed to demonstrate the safety and accuracy of ECOM. A porcine study published in the Journal of Anesthesiology demonstrated excellent correlation between endotracheal cardiac output monitoring and a transit time flow probe. ECOM is available in the United States and the European Union. In summary, ECOM is a promising technology for the non-invasive measurement of cardiac output and stroke volume variation. The placement of the sensors in the trachea next to the ascending aorta provides data from the patient's core vasculature, thus avoiding the negative impact of changes in vascular tone during the use of vasoconstrictive agents. The three-dimensional electrode array compensates for changes in position, allowing automatic adjustment to maintain high-quality signals. ECOM offers the ability to utilize goal-directed therapy through the measurement of cardiac output, stroke volume variation, and systemic vascular resistance safely, easily, and cost-effectively. Candidates for hemodynamic management with ECOM include patients with cardiac dysfunction, hemodynamic instability, and those in whom large fluid loss or shifts are anticipated. Examples of procedures in which non-invasive hemodynamic optimization can be useful are major vascular procedures, chronic hypertension, patients with coronary artery disease, thoracic surgery, elderly patients, large orthopedic cases, transplants, and trauma patients.